nominations. Let me see when we get started.
Yes.
The Health Committee is starting at 1:05, and first we're going to have the invocation by Chief Joe Byrd.
Our Father in heaven, we come to you today. We just thank you for the blessings you have bestowed upon our tribe and the leaders of our tribe. And we just ask you for guidance as we take care of the business of our people. And we just give you all the glory and thank you for the sunshine. In Jesus' name we pray. Amen.
Amen.
Call the roll, please.
Janelle Fulbright.
Present.
Dick Lay.
Here.
Jack Baker.
Here.
Harley Buzzard.
Here.
Joe Byrd.
Money.
Julia Coates. Jody Fishenhawk. Don Garvin. China Glory Jordan. Frankie Hargis.
Present.
Lee Keener.
Amen.
Curtis Snell.
Here.
Janice Taylor. Here. David Thornton. Victoria Vasquez. David Walkingstick. Kara Callan Watts. We have a quorum.
Thank you. Next, we'll have the approval of the minutes. I'm sure everybody's had time to look at them. Motion to approve in a second. All in favor, let me know by saying aye. Aye. Any opposed? Okay, the minutes are approved. We'll go right into reports. First, we have Claire Moore, Mr. George Valuers.
Good afternoon.
Good afternoon.
I think you have a copy of my report. Outpatient visits are still a little down. Revenues are still up, a little over 19%. One of the things that's not that, if we look a little further down, our admissions are up 26.9%. That's what we're attributing the increase in collections to is admissions. In fact, last week, many of you probably have noticed we had an average daily census of about 3 or 4. For a long time, we had over 22 people in the hospital a couple of days last week. So things are really getting busy and looking up. We received some new equipment from the State Health Department for newborn hearing tests last week, and training on that to our pediatric program. We submitted paperwork for our ADA accreditation, and that was accepted by the ADA for our diabetes program. Our outpatient pharmacy director, Commander Cindy Gillis, received the IHS Senior Pharmacist of the Year Award. So I wanted to give her a little pat on the back there. Any questions?
If not, well, thank you. Councilor Buzzard?
On the chiropractic clinic board, is that, you're saying 2 days a week, is that some person's on contract or?
He is on contract.
What is it?
Yeah, he comes in, and actually it's like a day and 3/4. He comes in all day Tuesday, and his half day Thursday usually runs till about 1 or 2 o'clock.
Okay. Is there any plans to expand that, or does that take care of the patients?
Right now, we still have a waiting list, so if we could work it, I would expand it a little bit further. But that was all he could work in right now.
I see. Okay.
Yeah, he does a great job.
Thank you. Thank you.
Any other questions or comments? All right, thank you for that good report. Next, we'll have Ms. Connie Davis, Cherokee Nation.
Good afternoon.
Good afternoon to you.
Well, we're busy. I think you guys know, because I see you guys pretty frequently now, it seems. Looking at our visits for the month of March, on the first page of our report, Lone P. Mankiller saw 9,707, Redbird Smith 9,437, Salina 8,145, J, 6,775, Nowata, 4,994, Muskogee, 13,442, Bartlesville, 2,092, Benita, 7,430, Gadugi, 357, and Hastings, 30,678. And I think that's the largest number I've reported for Hastings since I've been here. It usually hovers 27 to 29,000. So I think we're picking up some of the Claremore patients and trying to help them out, and that could explain that large jump in volume. Some highlights from our report. We have some new equipment to brag about, and the first of that is cardiopulmonary has purchased pulmonary function tests, new equipment to do those procedures, so those things won't have to be referred out. Imaging Services purchased a new CT scanner, which is an interesting story. I know some of you got calls, but our CT scanner at the hospital went down, and it was so old that you couldn't, replace the parts. And our staff worked with this company and got a new one installed in less than 2 weeks. The whole process of getting a contract, getting the other one removed and this one installed, I just can't describe the effort by the radiology staff. EMS had another truck to help transport patients to TCH, so patients' care wasn't delayed. So I want to commend Brian Hill and his staff, and Jimmy Summerlin and his staff, and Debbie Travis and her staff for a job exceptionally well done. EMS was accredited again on KHEP, which is another accreditation for them. It just shows the high quality that they provide in their services. In the emergency room and urgent care, we saw 6,584 patients. We had a left without being seen rate of 3.4% in the emergency room and 9.15 in urgent care, which is not a good thing to report, but we're working aggressively with Dr. Smallwood to make some changes in there. The turnaround time that has been asked to be reported was 167 minutes. We performed 428 surgical procedures. Dental clinic saw 6,608 patients in the month of March. Behavioral health saw 2,020, and I believe that's a larger number. We usually have around 1,800 and 1,900. 1,235 were unduplicated, which meant the other half of those basically were follow-up visits, showing that patients are getting care. And Jack Brown Center has a total of 24 patients, and we do have 19 on the waiting list, and we're staffing up, and that's kind of creating a little bit of delay, but we're working hard to get those positions filled so we can go ahead and accept the other patients that are waiting. We have turned in our application to become the first tribe to receive the public health accreditation. It's looking very favorable, and this will be a remarkable event in the history for Cherokee Nation Health Services. So we are excited to let you know as that progresses when we actually receive that certification. And there's several clinic updates in your packet. I won't go over all of those. I'll try to highlight the things that we're asked about most often. Contract health, Brett Hayes and Dr. Steelberg, you can see, are working very hard. 8,826 referrals in the month of March. Approval rating, 98.2%. So I'm really proud of that. A couple other things, just obviously I know most of you were at the Oshaleta open house on May 4th. I believe Counselor Lade, we had maybe 300 there? They were going outside the doors of the clinic. So we were really pleased with the turnout, and I think that shows the support of the community and how many patients we could begin to see at that clinic there in that area. So we're really proud of that. We have a letter of intent from a cardiologist who is an IHS payback, Dr. Arredondo. He should be starting with us in July, so we're really excited to be adding those kinds of staff, specialty staffs to our services. I was asked last month about how long it takes to get referrals for cancer and orthopedics approved and then an appointment. And we've done that research, and I think Counselor Jordan had that request. And based on an average of, I forgot the time frame, like 3 months, we had a average of 4.38 days to approval within Contract Health, and then 17 days to an appointment time, average overall. If you have more questions or want more detail, just let me know about that. And April 14th through the 17th, we received our annual accreditation survey from DNV. I'm happy to report we did have some nonconformities, but nothing that we can't correct, and we have received full accreditation from that survey. And that concludes my part of the report. Speaker Jordan.
I guess, Connie, my question to you on the cancer would be, from the time that they're identified as having cancer, how long are we taking before we do the initial referral?
It's an average of 4 days to get it approved. The referrals.
No, you're not, maybe I'm not conveying my question clearly enough. We go see the doctor thinks, hey, there might be cancer here. They send you for testing, then they get the test back. When does the doctor call you back in and say, well, it does look like cancer, we need to refer you out? See, I'm talking about the very beginning of the process, because every day counts when you have cancer. Once it's identified, every minute counts to get ahead of it. I've had it in my family. I've been very fortunate that I try to do regular checkups, and I have everything done at Hastings Hospital. Have always had everything done through the clinical system, and always felt like we were moving along fairly fast. But I can also see how, if you missed a step, how traumatic it could be to get to keep on going through the system. We need to look from the very beginning. Dr. A, you go in for your routine visit. So my next visit is August. My doctor says, well, I noticed something here. Let's send you down to, and usually they'll send you that day, down to X-ray or have you tested. They notice something, but you've gone home by then. Now it's going back to the doctor. Well, most doctors, or at least the doctors I've been involved with, are very good about having their nurses call and say, let's get you back in here. Now, what's the time there?
Okay.
Because I'm wondering if all doctors are keeping up with the pace. I believe they probably are, but we just need to check. Then once it goes back in and a doctor calls you in and says, yes, we're seeing something here, I'm writing out the referral, then how it's going to a committee, how long is that taking? And once that committee approves it, how long is it? Then I guess that's our 4.8 days from
Yes.
there.
Yes.
And then our 17 days out, which hopefully we could narrow that 17 days out, that we've got enough contracted doctors specializing in cancer that we can bring that figure back a little bit. Because every day counts to them. They've got this mass growing inside their body, and of course you want to get rid of it just as quick as you can, or start the fight to try to diminish its effects on your body just as quick as you can.
Right.
I think we've gotten a lot better. I'm very proud of health. Every time we see a problem, we get an answer for it. But health, and I think everybody understands here on this committee, there are new issues crop up every day. And this is one that maybe we can be a little more, we can lessen that amount of time, and every day that we can save might save a life.
Well, I understand what you're looking for now, I believe, and so we will work to see.
You got part of the answer. We need the other part
Okay.
to see where we are there.
Okay.
I think we're gonna find that they're probably doing pretty well, because what I see them doing is they're getting on I mean, I know if there's anything that's different about a test, that nurse is calling you.
Right.
We need to get you back in. Maybe we need to run the test again, or maybe it wasn't, maybe we just need to look at it. And usually it turns out to be nothing, but sometimes, you know, it leads to another test.
Right.
What's the time there is kind of what I wanna know.
Okay, I'll see how we can track that.
I appreciate you. Thank you.
Counselor Lay?
Thank you, ma'am. And also, along with the lines of what Tina was talking about, is there a difference still yet between out of Claremore, IHS area versus Hastings? I'd like to see that
The difference in,
time elements that she's asking.
we'll have to talk about that. Some of that we can track if it comes to our system. Is that what you're wanting? Because the things outside our system, we don't know.
Well,
So,
we need things outside your system.
outside of Cherokee Nation.
Well, I understand that.
Okay, so you're looking for Claremore, Cherokee patients, okay.
And is there do we have a full-time optimist at No Water?
Optometrist? No, not yet. We discussed that with Dennis Ewer. They will be helping us staff that clinic.
Okay, so you don't have one hired for Cooey Scooey, probably?
Not yet, no.
We're losing the doc at No Water. Has he been replaced?
Not yet.
And is Stalcup coming back full-time, or is he just there Fridays?
He helps on occasion.
Is he just there Fridays, or
I don't know his schedule routinely.
somebody behind you know that answer?
He's not there consistently, he's not on a regular, consistent basis.
Okay, the after hours in No Water, have they been deleted or changed, or?
I think the provider that's leaving is the one that was working some extended hours, and so until we can fill that position, or that vacancy, we can't offer those extended hours.
The appointments at No Water, if you called in today, when would you get an appointment?
I think it varies every day based on, providers that are working that particular day.
Would somebody get me an answer to that? I've been told it's November.
Okay.
Could that be possible?
I really doubt that.
Well, we know it's at least 3 months, maybe 4 months out.
The general practice is to not make a patient wait longer than 2 weeks. So I'll have to,
For No Water.
for all the clinics.
When will Cooey Scooey open? Drop dead open date with people involved and be there and ready for patients?
We don't have a drop dead open date. We're waiting on a couple of little minor things to make us operate without
Here's the
flaws.
deal. I'm talking to your folks, and they're giving me estimates of 3 weeks, 4 weeks, 6 weeks, and I'm not hearing any definitive answer. I'm hearing people give me their definitive answer, but do I just take an average and tell my people, well, it's gonna open in a month, so.
I can't give him a drop dead answer, but, there are 2 major things that are holding us up. One of them is the robotics in pharmacy, and that's not a huge holdup. If we had to open without that, we could. The pharmacists could dispense by hand. The big holdup is the lab. We're having some renovations done to the lab, and we only got the quotes last week. We waited till after the open house to start anything. They're supposed to get right in and get started. We think it'll be a couple of weeks, but there are contractors and things involved. We have to wait until they get done, then we'll move the equipment in. And once those 2 things are done, those are the primary things that are holding us up. We didn't want people having to go somewhere else for lab, if they were coming in. That's just not good service. So As soon as those things can get completed, we'll be opening. We don't have a definitive time yet, but as soon as we do, we'll notify you from the council.
And I've seen the lab, and I've seen the duct tape, and I assume that's where they want changes made. Is it only the cabinets and the shelving, or is it actually a lot of plug-ins and a whole bunch of stuff that?
It's gonna require, some IT drops, some electrical being moved in, and new cabinetry being made, and the drywall may need to be fixed and replaced, and then painting, things like that. A new center island where all the electrical and IT drops are gonna be required.
And in the meantime, I'd sure like to know how long it takes for these appointments at No Water.
I will try to get that to you by
And
tomorrow.
how long have we known Beeson is leaving?
Sure.
I don't know the exact date.
Right off the top of my head, I couldn't tell you.
Well, it's not off the top of mine either, but I've heard it for a while now. So, I mean, if this is the reason we're not gonna have after-hours clinics, if that's the I guess that's what I just heard, then should not we have gotten up to speed a little quicker on replacing it?
Anytime we get notice that a provider may leave, we have the recruitment staff working hard. But there is just a shortage of family practice providers, and, you know, even the contractors that we work with have difficulty finding them. That's why we want our own medical school and to work with OSU so we can grow our own and recruit them into our own clinics.
One last thing, sometimes my emails to the health department, especially to the director, are never answered. I'd like for those to be fixed. Thank you, ma'am.
Thank you. Counselor Buzzard?
Connie, just a couple of questions. On the pediatric doctor that's recruited for Jay, do we have any time frame on when that may come aboard? I had a lot of calls about people. It's a doctor,
I can follow up,
video samples.
yes, unless Dr. Montgomery knows off the top of his head. I'll follow up with an email to you.
Okay, and then the other thing is on the cancer, and it may be in here, I may have missed it, but I'd ask you last month, I must have sold over, to give us the stage 5 numbers on cancer. And you were gonna try to see if you could get the cancer people to
We got part of that data
Okay.
just this morning,
Okay.
but Dr. Montgomery has been in meetings. He mentioned to me before this that he finally got some information. He hasn't had time to read it and give a good response to the council.
Okay.
So I'm hoping next time he will have that prepared and be ready.
Okay. And then, well, unlike Council AR, I had good luck out of Connie and send me the email back. I appreciate it, Connie.
Thank you, sir.
On the
Closer
response.
to it.
Maybe it's getting lost in the mail or something, I don't know. But that brings up another subject, and let me just throw it out real quick. You know, I'm getting a little upset about when I send emails or telephone calls to the staff here at the Cherokee Nation. I'm talking about directors and people that answer the phone. I don't get a return call, I don't get an email answered. And I'm almost to the point of asking this committee to consider legislation on something like that. I know we don't handle the administrative part of it, but I'm trying to do a job out there, and it's kind of hard to do your job when you can't get answers from people that work here at the Cherokee Nation. Some of the executive directors do really well, but some of them just do not respond. So anyway, just think about that. Thank you, Connie.
Secretary of State?
Yeah, Counselor, I sure regret any phone calls or emails that have gone unreturned by any of our staff. Kanan Duncan is here, is a person I would recommend that you CC on communications. He helps, part of his job, big part of his job is serve as a liaison between this branch and the executive branch, and he will continue and does do a good job of tracking those requests, so we will do better.
Thank you.
Counselor Buzzard, I will share my experience. I send everything to Kanan Duncan, and if they don't respond back quickly, he tracks them down, and I get an answer back. He does a good job.
Yeah, and I usually do that, and for some reason I didn't do a couple like that, and that's probably my fault for that, but.
Well, he gets hot on their trail, so.
I'll do that.
So, that's helpful to me. Counselor Watts?
Thank you, Madam Chair. And if I read it correctly, I think I walked in on the contract health discussion, we're still at 98.2%.
Yes.
So what's the description of that 1 or 2% that get denied?
Generally, it's lack of appropriate medical documentation or medical necessity from the physician.
So in the end, they probably are approved, they just have to go back through, because I think we talked about tracking that at one point, but.
And because of the way the system works, Mr.
It's
Hayes
just
is
not-
unable to do that.
Well, and I would rather have him focused on delivery than, but if it was possible, it'd be good to understand that
Yes.
part. So, I had that question too, because I didn't realize, I wasn't able to make the event, that it wasn't a grand opening, that the clinic wasn't open, so so we do not have a date that it will be open, if I
Not at
understood
Cooey
correctly.
School, no.
How many positions do I heard that there's construction issues and therefore services or such aren't in place for capacity, but how many open positions do we still have to fill, especially with things happening at Nowata that I'd heard about?
Well, I don't know how many we have to fill. We've had a good recruitment effort in that area. And I know we have 11 staff from Bartlesville moving to that clinic, and I believe we added 26 positions to that 11. And we've done a good job. I can get you an update on the
And
current.
those are how many of those are primary care physicians?
One
or
doctor.
There's one additional doctor gonna be
Yes.
added.
Yes.
Is there any nurse practitioners or
Not at this
physician's
time.
assistants for those things?
Not at this
Okay.
time.
And then, let's see, you said something earlier that struck me and I wasn't quite sure what it meant. Now I should have made a note. I didn't realize it was going. So thank you for your time. Thank you, Madam Chair.
Chief Berg, you
I
have
was
a
going
comment?
to comment. The visits that we have had at the recreation center, it's around 11,000. That exceeds some of the clinics, if you notice. And with that, we are really putting some time on the equipment there. So you guys have done a good job keeping those updated. And but I appreciate your staff back there, because usually when I give them an email, I usually get a response. Because I expect a response, because if they're calling me or emailing me, I'll respond to them, so it kind of works that way. Or I know where their offices are. So I appreciate what you guys are doing, you're busy, but just check out that equipment one of these days when we get some money in. But we got a lot of priorities before that, because we got the hospitals and the clinics coming first, and I appreciate what you guys are doing.
Thank you.
Thank you,
Any
Madam
other
Chair.
questions, comments? When we get finished here, I'd like to meet with you about some elder care questions.
Sure.
I'll visit with you when we have more time to talk about it. Okay, moving right along. I thank you for that good report. In old business, we have none pending, new business, none pending, and announcements. The next meeting is tentatively set for June 15th at 1 p.m.
You did good, Madam Chair, it's a record.
All right, motion to adjourn. Second. All in favor of adjournment, let me know by saying aye. All right, we're adjourned.